Hello, my name is Kieran and I am a qualified St John's Ambulance First Aider. I am here to show you the treatment of several common injuries that can occur in the outdoors, in the workplace and even at home.
Okay, ready? Scenario 1. Treatment of an unconscious casualty. On discovering a collapsed casualty, you should first make sure the scene is safe and then establish whether he is conscious or unconscious. Do this by gently shaking the casualty's shoulders. Always assume that there is a neck injury, so shake shoulders gently. Ask,
"Are you okay? What's happened?"
or give a command such as,
"Could you open your eyes for me, please?"
always speak loudly and clearly to the casualty. If there is no response, shout for help.
"Help!"
Then, in order to open the airway, place one hand on his forehead. Gently tilt his head back. As you do this, the mouth will fall open slightly. Place the fingertips of your other hand on the point of the casualty's chin and lift the chin. Keeping the airway open, it's time to check their breathing. Look for chest movements, listen for sounds of breathing, and feel for breaths on your cheek. Do this for no more than 10 seconds. If the casualty is not breathing, you must call emergency help immediately and begin CPR with chest compressions. However, if the casualty is breathing, check for any life-threatening injuries, such as severe bleeding, and treat as necessary. It's time to place the casualty into the recovery position. First, kneel beside the casualty, remove glasses and any bulky objects such as mobile phones or bunches of keys from their pockets. Make sure that both the casualty's legs are straight, and place the arm that is nearest to you at right angles to the casualty's body, with elbow bent and palm facing upwards. Bring the arm that is furthest from you across the chest and hold the back of his hand against the cheek nearest to you. With your other hand, grasp the far leg just above the knee and pull it up, keeping the foot flat on the ground. Keeping the casualty's hand pressed against his cheek, pull on the far leg and roll the casualty towards you and onto his side. Then, monitor the level of breathing response and pulse until help arrives.
Scenario 2. How to apply a sterile wound dressing. Ask the casualty to elevate the limb and to apply pressure to the stem of the bleeding while you fetch a first aid kit. Unwind some of the bandage, taking care not to drop the roll or to touch the dressing pad. Unfold the dressing pad and lay it directly on the wound. Hold the bandage on each side of the pad as you place it over the wound. Wind the short end of the bandage once around the limb and the pad to secure the dressing. Wind the other end of the bandage around the limb to cover the whole pad. Leave the short end of the bandage hanging free. To secure the bandage, tie the ends in a reef knot. Tie this directly over the pad to maintain firm pressure on the wound. Once the bandage is secured, check the circulation in the limb beyond it. Loosen the bondage if it is too tight, then reapply if necessary. Recheck every 10 minutes.
Scenario 3. The elevation sling. This helps to control bleeding from wounds in the forearm or hand and minimize swelling. An elevation sling is also used to support the arm in the case of a shoulder injury. Get the casualty to support his injured arm across his chest, with the fingers resting on his opposite shoulder. Place the bandage over his body, with one end over the uninjured shoulder. Hold the point just beyond his elbow. Ask the casualty to let go of his injured arm. Tuck the base of the bandage under his hand, forearm and elbow. Bring the lower end of the bandage up diagonally across his back to meet the other end at his shoulder. Tie the ends in a reef knot at the hollow above the casualty's collarbone. Tuck the ends under the knot to pad it. Twist the point until the bandage fits closely around the casualty's elbow. Tuck the point in to secure it. Check the circulation in the thumb every 10 minutes. Loosen and reapply if necessary.
Always keep a fully stocked first aid kit to hand. You never know when you will need it. Thank you for watching and stay safe.